We do not want to end up in court. Our goal is to work with patients.
For years, the state's largest and one of its best-known medical systems has done something that to date has yet to appear in any of its glossy ads. Suing patients never has made for good PR.
Do you know how many you sued last year?
I don't have an exact number.
To the credit of UC Health's chief legal officer, we did eventually get that number, which last month we reported. We also reported this. In 5 years, UC Health sued more than 15,000 patients.
I was shocked by your story. I was shocked at the volume of the cases.
State Senator Sonia Hawkes-Lewis saw our story. So did State Senator Lisa Cutter.
That was a great story, and I really appreciate the reporting.
15,000 lawsuits in 5 years. 8 patients a day, roughly. What do you think?
I think that's shocking, and I think that's not how it should be.
What also got their attention? What we also uncovered, UC Health has sued patients not under its name, but under the name of one of its various debt collectors, a practice that has allowed it to largely escape public scrutiny.
What I can believe could be the case is the hospitals would find it a lot easier if their name is not going into the court system every single day.
Here's how it's done. Let's say Hospital X wants to sue Jane and John Doe for an unpaid medical bill, but doesn't want the public to know how often it sues patients like the Does. So it sues them under a name of a debt collector. And poof, no way to publicly link Hospital X to the litigation.
This is the normal course. This is the way things work with these vendors, and it's how we do it.
How we do it, says UC Health. So last year, Senators Cutter and Hawkes-Lewis tried to stop how UC Health and other hospitals do it.
Senate Bill 93. Tell us about your bill.
If you want to sue someone for an unpaid medical bill,
This type of transparency enables consumers to identify the debt.
the bill said you need to sue under your own name.
This bill will begin to untangle the complicated web of medical debt.
Only problem,
My name is Brett Riley. I am
Thank you, Madam Chair. My name is Tom Ramola.
debt collectors
Senator, I'm Alan Greenberg.
My name is Catherine O'Brien.
didn't seem to like the idea.
Members of this committee to consider amending this legislation.
We have an amendment
So I am
out
here to advocate for the amending this legislation.
In the end,
I move Amendment L002.
their words worked. Legislators amended the bill, which gutted the requirement.
It's really important that consumers know who is suing them.
Colorado Attorney General Phil Weiser says it's time to try again.
Who is this debt collector? What's the underlying debt? You, as a consumer, you should know. What debt are they talking about, and what rights do you have?
House Bill 1380 says a debt collector can sue under the debt collector's name only if the debt collector owns the debt.
I believe there is time for us to do something about that this session.
Should it pass, hospitals like UC Health would be forced to either sell their debt or sue under their own name. The latter would once again make their lawsuits open to public inspection. Chris Vanderveen, 9 News.
That new piece of legislation gets its first committee hearing in about a week and a half. UC Health insists that it is not an outlier when it comes to the number of lawsuits filed, but due to the issues that Chris has identified, it's nearly impossible to verify that claim using the state's court system. We want to know about the issues that you are running into with your medical bills. Email Chris and our team at showusyourbills@9news.com. That email address again is showusyourbills@9news.com.